I'm joined by Emily Tempels, part of the team at Hummingbird Healthcare. Hummingbird is a sponsor of the upcoming healthXchange Patient Access Program taking place on Tuesday, February 27th. Emily will be moderating the opening panel discussion, which will focus on patient access leadership development, change management, and where we'll hear from executives on areas for optimism in the year ahead. Emily, thanks so much for joining us today. To get started, could you tell us a little bit about yourself and your professional background, how you got your start in the healthcare industry, and some of the roles that you've enjoyed so far?
Yes, happy to. Thanks for having me. So my start in healthcare, I feel like healthcare has just been in my family, and that's really how I got started. My parents are both in the field, my sister is in the field, and decided that it was the right fit for me, honestly, after not doing so well in general chemistry, because I thought I was going to be a provider, but decided to pivot to the business side and found that economics and operations were definitely a better fit for me. So it's just kind of been where I thought I would always be. And it's actually pretty fun every day to come to work and think, I'm doing what I really wanted to do. So as far as getting started in healthcare, I started my career at University of Colorado Hospital before it was the full-fledged UC Health system. And I was the administrative fellow there for a year. So that gave me exposure to every single hospital department and area, and access to the leadership team for learning and mentorship. And so I actually created a pretty strong bond with the vice president of ambulatory services at the time. And so after my fellowship, I went to work for her and did a variety of roles kind of progressively. And she helped me move into the people management functions along with daily operations and project management. So in that time, I led quite a few big strategic projects for the ambulatory service line, and then took on the management of the referral and prior authorization center that was just starting to grow, was about 30 people, and that was way back in the early 2010s. So it's grown a lot since then. And then as University of Colorado Hospital was becoming a health system, we had some strategic leadership come to the organization and decided that patient access needed to be a key priority, a strategic priority. And so there was this movement to create one point of entry, a comprehensive full service patient access center. And so I got to be part of the really small team that launched what is now Patient Line from the ground up. So we did everything from all of the technology and telephony selection through building of all the support services, your training program, quality program, workforce management, analytics, to actually building all of the workflows that the contact center would use to operate. That included a marriage of academic and community providers into a single platform because the contact center needed some level of standardization to be successful. So that was definitely my biggest project. And then I got to operate the contact center for a few years thereafter. So big chunk of time at UC Health. And that really paved the way for me to move into consulting, which I've been doing for the last 6 or 7 years now, to help. I wanted to help other organizations overcome what we overcame at UC Health, because I thought that I had a lot of learnings and good things to share, and also plenty of things to try to avoid doing it a second time. So I started consulting with Blue Tree, was there for a couple of years, and then that was acquired and became Tegria, and now I'm recently with Hummingbird. So similar group to the Blue Tree founding group, and excited to work with these folks again with a new adventure specifically about patient access.
Thanks so much for sharing a little bit about your background. It sounds like you've had some great opportunities to work on a real diverse number of projects with different organizations, really exciting work that you've been doing. Tell us about Hummingbird Healthcare and some of the projects you're working on now as you help to reimagine patient access.
Hummingbird has been a really fun journey from the start. So we've been in existence for about a year, but really doing work in earnest for the last 6 months or 7 months now. And so our core focus is really to create the modern patient experience. And that looks a variety of ways, but we are anchoring in patient access as a service. So we are not a technology company, we're a services company. And we think that with our marriage of expertise in hardcore patient access operations and Epic operations and Epic technical, that we can create a new way of approaching managed services for contact centers. We're also taking a very deliberate look at the people side of this and trying to create a foundation in some new methodologies about how you think about the work in a contact center, how you give agents more agency and let them solve really hard, complex issues that you cannot just offload to automation or AI, but how do you use those tools in the right balance so that patients are getting what they need, providers are also getting to see the patients they need to see, and we have some continuity of care from the start of the phone call through your appointment and follow-up afterwards with the same group of people. So we are on the journey to be that managed service provider for all things patient access, but really operate your contact center and then all of the support services that it needs to be successful.
And I really love what you said about helping the agents have agency. That's such a critical component in building expertise and ownership of the work, which can be really difficult in some aspects. Well, we're really happy to have you joining our upcoming panel, our Patient Access Leadership Panel, where you'll be moderating the conversation. Tell us a little bit about what you're looking forward to discussing with the panelists or benchmarking with peers during that session.
Yeah, I'm really looking forward to this transparent and trusting environment where we can openly share our experiences and our challenges and then collaborate really in this forum as a start and then expand thereafter to figure out how we might be able to tackle some of the same problems that every organization is having in their own silo. How can we do that more collectively to find a better solution? So really interested to hear what folks are doing today in their contact centers and rev cycle operations and where those things are coming together or diverging, because we see it in a little bit of a different mix depending on the organization that we're working with. And I'm always curious to see how you navigate the single patient experience across the entire enterprise when it touches multiple teams, front end and back end operations, right, and how you bring that all together. So looking forward to hearing what people are doing, but also then what do we need to solve and how can we have an open discussion about that.
And I certainly think it'll be a great conversation, and we're really looking forward to having you moderate the session and to having Hummingbird participate as a sponsor for the program, and we look forward to it.